Hey everybody, Blake Hogger here with FTB Organics. So this is going to be the first video of a couple that I'm going to do that speaks specific to the CBD industry or cannabis as a whole and how it's helpful for people dealing with different medical conditions, whether it be from mood altering conditions to joint pain issues that they might be dealing with. So I recently picked up a magazine, and on the front of it, it said CBD and wellness, memory, sleep, and pain relief. I mean, how could I pass that up? One of the articles that I'm going to read some of talks about the cure for creaky joints. Now, obviously, as a disclaimer, the FDA has not approved any CBD products to be effective for any type of cure for any type of medical condition. So there is only one CBD product on the market. It's called Epidiolex, and it is a CBD product that's used to help treat children that deal with one specific type of epilepsy. All other types of CBD have not been FDA approved yet, but this article is great. This is going to be a little bit longer series because I really want to be able to read some of this content and to provide some knowledge to you. So there was a doctor, and basically what he did a study from is, let's see here, it says the anatomy of joints. Obviously, we know we've got cartilage, which is the soft tissue that covers the surface of the bones at the joints of contact and reduces friction. Synovial membranes is the oil, the joints that secretes and lubricates the joints. The ligaments are elastic bands of connective tissues that support the joints and prevent hyperextension. There's tendons, and then there's also burses, which are fluid-filled sacs in between the bones and ligaments, providing a cushion and weight for weight-bearing joints. In simple terms, joint pain is typically caused by inflammation or swelling or by direct bone-on-bone grinding or impact. Many people also develop inflammation or swelling due to injuries like mine, specifically from tendonitis or bursitis. I've had tendonitis, or from ailments like gout, lupus, and cancer, which I've not had. When it comes to arthritis specifically, most people suffer from osteoarthritis, which breaks down cartilage, or rheumatoid arthritis, which is an autoimmune disease that causes inflammation. So let's talk about some treatment options. Osteoarthritis usually results from injury, overuse, or infection, with the initial damage often accelerated by obesity and lack of exercise. A Harvard University study showed that cases of osteoarthritis in the knees had doubled in Americans since 1950. And a lot of it is due to weight gain. So here's the part I want to kind of jump into, because it talks about, arthritis and some of these other things that it's in. But there was a scientist, scientists and physicians are also starting to recommend cannabis as a potential remedy. Kevin Bochnik, a PhD research investigator at the Chronic Pain and Fatigue Research Center of the University of Michigan Medical School, is one of the doctors and scientists that have done a lot of research on cannabis for these types of ailments. One of his studies, published last year in the Journal of Pain, surveyed 1,321 respondents who substituted cannabis for traditional medications in search for a better pain management. The vast majority of the respondents reported positive results in the form of reduced pain and milder side effects, enough that many, but not all, had forsaken their previous prescriptions. Most significantly, 72% of 690 opioid users experienced such good results that they had completely stopped using their opioids. That is huge, especially with the opioid pandemic that we have going on in America. As Bohuni, whatever the doctor's name is, notes, his findings has significant ramifications amidst the opioid crisis and has killed more than 100,000 people over the last 5 years. Marijuana, however, definitely has negatives, he notes, like damage to the lungs when smoking and adverse effects to young brains. But no one has ever died of cannabis overdose. If you compare the relative merits of opioids and cannabis for pain management, cannabis is the clear winner. Another thing he says here, the doctor warns, it's a tool that may be helpful for some people in some conditions and may be helpful for some forms, but not others. But the downsides are so limited that doctors ought to be educating patients and helping them find their own answers. This guy posed a hypothetical scenario, but either way, we don't need to go through that. There seems to be a sweet spot in dosing, and this is something I try to talk to people about when they ask how much that they should take or what they should be feeling. And this doctor says, it seems there should be a sweet spot in dosing, this doctor tells. If you take more than needed, you don't get any additional benefits and may actually reduce the benefits. This doctor generally believes that tinctures work best for chronic pain. Smoking and vaping take effect very quickly but don't last only but 2 to 4 hours. Edibles behave more like time-release medications with a more sustained benefit, but dosage can be hard to manage. Tinctures are easier to measure. They provide steady, long-lasting symptoms, and this is the oils that we would carry on the FTB Organics website. And they provide steady, long-lasting symptom relief. Hold under the tongue for at least 2 minutes, and they don't pollute your lungs with combusted materials. There have been few studies conducted on topicals, and most products contain other additives ingredients. Let's see. This doctor also sees wisdom in using a salve in combination with the tincture. So on our website at ftborganics.com, we actually offer a discount for people that want to buy the tincture and our pain cream as a overall plan to help with some of the joint discomfort or pain that they might be experiencing. Again, we're not claiming it's going to fix you, but we're trying to give you the best option with our USDA organic products, as well as no added, anything in our tinctures. Obviously, in the pain cream, you have to have some additional ingredients in there for preservative purposes, but we've gone to every step to make sure that what is in our bottles is healthy for you. It's organic and as naturally sourced as possible. And, it's clear as more studies come out that, CBD products are showing to be extremely beneficial for people that could be dealing with joint issues or pain in their hands or their wrist or their elbows and these areas where this arthritis can be starting up. So again, we're not saying it's the cure-all be-all. We're not telling you not to go to your doctor and be evaluated. But what we are recommending is that if you want to try another angle to help combat or give you some relief with these issues you're having, we would love to support you in that process and to get your feedback on how our products are helping you. We already have several people that are using our products for arthritis in their hands and their elbows and their neck specifically, that are just having great results. So that's a little education on an article that I read this week. And we would love for you to check out our website at ftborganics.com. Please feel free to engage with me on any questions you have or where you'd like to know more about our products. Another great thing about each one of our products, it's really important that you look forward to, is that when you're looking at a product, you want to make sure that the certificate of analysis, the COA, the third-party lab test is available on the website. We also provide a QR code on all of our products, which will link you directly back to the QR code for the exact hemp CBD extract that's in the bottle that you have. So I appreciate you watching. I know it's a little bit longer than usual. This is just a little education video that I'm going to put out, and I hope you liked it. Take care.